Right, I just want to go through at this point, sort of talking through how I do all of the abdominal organs, just to give you a bit of an idea of, how I'd run an ultrasound examination. It's absolutely not to say that the way I do it is the perfect or the only way. In fact, so we think we have 8 diplomats currently working doing ultrasound at our practice. Every single one of those scans in a different way. So there's literally as many ways of doing a scan as there is people doing them. What I would encourage you to develop is a routine, because otherwise you get distracted, you wander off, you forget what you're doing, someone asks you a question. You come to write down some notes about what you did and you find that you forgot to do something, and there's nothing more frustrating than having to get the patient back afterwards. So our protocol, or my protocol, is to start with the patient lying on their right hand side, as actually we've done a lot in the practical sessions. I start with the kidney. I find it quite a friendly organ. So I do a sagittal examination of the kidney. I turn through 90 degrees and I do a transverse examination. I go right the way through from pole to pole, make sure I get that renal pelvis. I drop down and do the adrenal, as it's right next to it. If it's a female dog, I'll look for the ovary as well, just caudal to the kidney. I'll then follow the aorta along, pop the colour Doppler on just as I get to the trifurcation, and have a little bit of a look for the medial iliac lymph node as well on the left side. I'll drop down and do the colon, so I pick it up, transverse orientation, and slide my probe cranially until we get around that transverse colon. So that involves sliding here, see as far as I can get. If I can get right the way around to the iliacecolic junction, all well and good, but in a big dog like this one, I probably wouldn't be able to. Then I move my probe back to the pelvis. It's the only time I'm not actually being useful while moving my probe. So I come back to the pelvis, I'll have a look around the bladder, both in a sagittal orientation but also in a transverse orientation. I would have a look for the uterine stump or uterus, have a look for the prostate while we're here as well. Then I look through the small intestine. So my approach to the small intestine is not to try and follow it from one end to the other, because I think that's not really very feasible. I do a zigzag pattern. With the probe always at 90 degrees to the patient's skin surface, so I'm kind of examining the field as if it's a volume, and I'm just slicing my way through to make sure I don't miss any of that volume. So I zigzag along until I find the spleen. I go right up, find that splenic head in the ribs, go right down, find the splenic tail. I come cranial to that. I'll pick up the left limb of the pancreas, just deep to the spleen, examine the stomach, right the way up to the fundus, all the way down and underneath if I can, to have a look on the other side. And then do the ventral aspect of the liver. Then I flip over. I start again with the kidney. Do the right kidney, right adrenal, right ovary. Follow back, cauda vena cava, along to the right medial iliac lymph node, down. I do the bladder again. I tend to find that you really don't see very much on the near wall of the bladder. So if you do both sides, I feel like I've seen that better. I'll zigzag through the small intestine. Now at this point, because it's on the right side, I tend to find I see the jejunal lymph nodes better and the iliacecolic junction better. Once I get to this level here, I can pick up the duodenum and the pylorus coming out, making that hook shape, the associated pancreas, drop down and do the liver and the porta hepatis coming in. So in that way, we've been through all of the abdominal organs, most of which we've talked about over the last couple of days. I don't do it sort of systems based, you'll notice. It's definitely on anatomic location. And that's definitely a personal preference. I find it just a little bit more efficient. I'm not the quickest scanner, so anything that can help me speed up has got to be good. But some people do it by, organ system. So whatever you find works for you, then make that a routine. I reckon we get cases in about every 45 minutes. That's the diary. They come in. They've already got their sedation written up, so we would immediately give them sedation IV, clip them and prep them. I would do the scan, write the report, and then the next one would come in as we go through. And it takes me probably about 30 minutes of that time to scan a dog, a bit less for a cat, maybe 20 minutes for a cat. And so the rest of the time is, if we have to do some FNAs in addition, obviously that slows things down a little bit. And you'd just be surprised at how delays sort of creep into a day, despite the best efforts at being well prepared. So it's not a massive time commitment, actually. Half an hour is, I think, feasible to put aside for a scan, but obviously that's once you've got your sort of skill set up, so it takes longer to do a scan until you're sort of getting a little quicker.